Thanks, Lynn. It was really good to get the heads up that this wasn't pure science that we did. And I feel very fortunate that I'm the person that either drew the long straw or the short straw. Am I high enough? Okay. Depending on how you look at it. So I wanted to thank NutriShare for this award and for our ability to present the information that we have. I also want to thank my co-collaborators on this project and give some recognition to them. That would be Abby Brogan, who's also a mom and an advocate and caregiver and a advocate extraordinaire, and our clinical director, Deb Pfister, who provided us support and guidance on this project. To kind of give you some background, I'm trying to stand up and not bend over, on this project and how we got to this point is that for those of you who don't know me, I'm a mom of a 20-year-old who's been on nutrition support, either TPN or enteral nutrition since birth. And in addition to that, I'm an advocate for a home infusion company, and my role as an advocate is to provide support to consumers, to connect them to resources and information that's important to them. But also as an advocate team, one of our missions is to identify areas and concerns that consumers face and try and find direction in terms of what we can do to help. And sometimes the concerns that consumers face are clinically related, and other times they're emotional and support related. And so that's how this process got started. And I'm pressing forward. Can you help me out here? Where's yes, okay, there we go. So there's some literature out there already that discusses emotional needs and concerns of individuals who have chronic disease. And there's data that supports the fact that many people face challenges emotionally when they get that diagnosis. In addition, I know that Emma referred to Marian Winkler studies that she's done on quality of life, and Carol Smith has done studies of HPN consumers that address some of the emotional challenges that consumers face on a daily basis. And so we understand that, in our conversations with our consumers, as well as networking that we've done here at the Oley Foundation meetings, and then on social media, we've been in contact with a lot of consumers and caregivers who frequently experience emotional issues and concerns in toll because of the diagnosis as well as the therapy that they deal with. And some of the things that we hear about are depression, anxiety, post-traumatic stress syndrome, among other issues. I feel like. And so our objective and our goal in this project was to try and get a better understanding of what those emotional and mental health challenges were for individuals who are on TPN and enteral nutrition. And not only for the consumers, because a lot of times we talk about the consumers themselves, but for those of you in the audience who are caregivers of either children or your spouse or your significant other, that there's a toll that takes place on them as well. And so we wanted to examine what their experience has been, as well as identify what type of support that they've been given, if any. So our question in the study was to identify whether or not there is a need for a mental health professional to be part of that integrative program when people get support for their intestinal rehabilitation. And apparently I'm having, okay. So we conducted an online anonymous survey, was distributed via social media. And we obtained some basic demographic information, including the age of the participant, indication of whether or not they were a consumer or caregiver, if they were being followed by a single practitioner or being managed by a team of a comprehensive or integrative team, as well as their diagnosis, the type of therapy they're on, as well as their experience with mental health challenges. So when we look at the results, we had a total of 184 participants who were on some form of nutrition support who completed the entire survey. 161 of those were followed by a team of professionals, so an intestinal rehab team. 120, or almost 2/3 of the respondents, were caregivers, and the remainder were consumers. And then we had a mix of both TPN and Enteral, as well as just Enteral. And then their age distribution is up there. A large portion of our respondents were under the age of 40, but we did have a number of respondents that were from 40 and beyond 50. So the question that we asked at the beginning of the survey of all of the consumers who responded, and that is, should mental health support be part of that integrated service or care that you're getting from your team? And an overwhelming 95% felt that emotional support should be addressed when they're getting care for their intestinal needs, whether it's short bowel syndrome, dysmotility, intestinal failure. Now, we did give them a list of symptoms, and it's kind of hard because I know that a lot of people talked about diagnostic type issues that they were dealing with, such as depression or post-traumatic stress, and we tried to focus more on the symptoms that they would be experiencing and ask them to indicate which one of those areas, fear, anxiety, fatigue, being overwhelmed, that whole list of there, to check all that apply. And in this case, almost 3/4 of our respondents indicated that 7 or more of those type of issues that they were dealing with. When we look at the top 3, fatigue, fear and anxiety, and the feeling of being overwhelmed were the most common feelings that people had. And I think if I look out to the audience, my guess is that many of you who come into a situation with a diagnosis that you've never heard of before, and then in addition to that, get involved with this therapy that you've never had experience before. In some cases, we do have clinicians here that ended up on therapy, but in many cases, there's a big learning curve, and so there's the fatigue can come from the therapy itself. It can come from the lack of sleep because of infusion type things that people need to do throughout the night, from pumps alarming. But they also could be clinical things too. So as a clinical team, I think that there's issues that need to be looked at in terms of sifting through between what part of that fatigue is emotionally related and what part of that fatigue may actually be related to medical issues with dehydration and things like that. And sometimes consumers don't always think about discussing those issues and keep the emotional portion of what they're dealing with very close to the vest. So we also asked consumers, when did these symptoms begin? Because when we did this project, we were thinking about, how can we help consumers? And so we thought it was important, if we were going back to clinical teams, to get them to think about what kind of information consumers need to have, but also when's the best time to present that. And what we found is that, a portion of the consumers felt that it started, at the very beginning, and there were some that began experiencing difficulties further on in the diagnosis. But over half of them indicated that they experience those conditions, the emotional needs and the emotional stress from the beginning and throughout the diagnosis. And so it was an ongoing need that consumers had. Now, the next question that we asked consumers is whether or not they sought professional help. And I think that sometimes, I think that mental health support and mental health issues have become less taboo, but it's very clear that there's still some hesitation that people have in terms of seeking support when they need it. So we had a little over 50% who did indicate that they did reach out for support and sought professional help. And of those, we wanted to know who was the one that inspired or initiated the consideration of getting emotional support. And what we found was over 50% of those individuals who did get help made the decision on their own to get it. Whereas, there was some clinician referral for support, but it wasn't happening in all the consumers. And so we wanted to know, for those individuals that didn't get support, how did they handle that? How did they deal with those symptoms on a daily basis? And so we did see the vast majority of them turn to family and friends. And I know that Emma had kind of referred about how family can be the most supportive. But I also know that we've been in contact with consumers who have family members that, after many years still don't understand and aren't able to provide that support. A large number of our respondents, and not surprisingly, I guess, because we were doing the survey on social media, that people did turn to social media to connect with other individuals. And then support groups, such as the Oley Foundation, becomes a big help for those people that don't get emotional support. And peer-to-peer support comes into play as well. Now, what we wanted to know is, and we looked at this because I think that what we really felt that there was this, disconnect sometimes, as I mentioned earlier, where we do have consumers who are getting the emotional support, possibly, but we wanted to know, where the caregivers come into play too, and are we making sure that as clinical teams, when they're working and supporting the family, are they looking at the emotional needs of the entire family? And what we found is that there was really no difference in the amount of support that they got, and so both the caregivers and consumers, it was around a little over 70% that they reported that they did not get any type of emotional support. Because we have an advocacy program that we're really proud of, and we really do our best to support our consumers, we did feel that we wanted to ask this question about advocacy to find out, who out there had an advocate that was working with them. And of the consumers that we spoke to, a large portion of them, 2/3 of them, did not have an advocate. And those that did, we asked whether or not that advocacy was a beneficial to them. And over half of the respondents did indicate that advocate that was there for them was able to help them through some difficult times. Okay. So these are the kinds of things that we'd like to take forward, and I think when we were talking, and Abby had the opportunity to present this at Aspen, is to remember that the diagnosis of a chronic disease as well as the associated therapies can cause a great burden, not only on that individual consumer, but on the families as well. And patients and families, from what the research that we've done, do feel that there is a significant need for mental health support to be integrated into the care that they are given on a regular basis, and a comprehensive intestinal rehab team. And then finally, clinical care doesn't always take into account the emotional impact. And based on the fact that 41% were not even offered the opportunity, or the discussion was brought up to identify, further need to get mental health support. So, I know there's a lot of clinicians in the room, but there's a lot of consumers too, and I think there's some things that, I would like, to consider as takeaways from this. And one is clinical teams can play definitely an important role in providing resources to help consumers not only identify signs or to identify the signs of emotional stress and support. I mean, and once again, I'm going back to the original part of it, is being able to tease out which part of those symptoms that you're experiencing have to do with your physical well-being, and make sure that that's under control, but then what part of those may actually be, a psychological manifestation. And then also referrals, consider referrals. If a mental health professional, either a social worker or a psychologist, is not part of your team, how can they be incorporated to involve them in helping better the patient's quality of life? And then last but not least, certainly direction on how they can better cope. And I know for us as a family, the Oley Foundation has certainly been there for us to meet other people. We've had a lot of discussion today about normalizing experiences and being able to kind of bring it together and have a community. That's all. So thank you very much.
That's okay.
We have one question. Can we take one? Do we have time to take one question?
This is going to be the question period. Relax.
Okay. Relax.
She's kicking me off the
stage. Yeah. No, each of these presenters has got 20 minutes, and she's only used 10.
That's all you told me I had.
10 to present.
Okay.
No, 10 to discuss. Because this is really when the discussion actually is helpful to the audience. So this is a project which actually asked for people to volunteer that they needed some help. So it's not across the board a representative sample of people who go on these therapies. It's people who are on the therapies who felt they could have had more help. And then also you would agree, I think, that it isn't really clearly defining who should help. The suggestion is there that it should be a mental health worker, a psychologist, or even maybe a psychiatrist. But all of us know that these people probably know very little about the therapy and the stresses, and bringing in another professional is expensive. And so one of the questions becomes for many, many people, what's out there? What other alternatives would I have? And obviously the Oley Foundation has made this an important part of their mission. So I think your contribution is right in the middle of relevance, even though I have some questions about what you've ultimately defined. So I think it would be very nice for people, and especially I would like to call on Marion, to come up with some thoughts about this. But I would mention that there's been a lot of studies, particularly on parental nutrition, showing that whether or not you can handle it initially depends a little bit on how you got into it. So if you were a Crohn's patient with short bowel who was slowly grinding into a standstill because of your weight and your energy, then to start parental nutrition, both for you and your family, is a godsend. And you feel almost every month a sense of recovery. And there's some very good data to show that those people really don't suffer depression. They immediately are very much relieved that they can see some future. On the other hand, if you were unfortunate enough to overnight infarct your bowel, and yesterday you were eating and living normally, and today you're told you aren't going to be eating again, or you're not going to be eating normally again, that's a huge problem. And so there is a tendency for those people to swing through a pretty serious reactive depression, which takes usually about a year to begin to move out of.
Well,
So,
can I interrupt just a moment,
yes,
please?
you can.
Because counterpoint. I do think that things tend to get better for consumers, but I also know a lot of it may depend on their stability or instability. And so that, in consumers that we've met with and talked to, that a lot of times if their medical condition is not stable, if they have frequent hospitalizations, frequent surgeries, maybe TPN hydration levels, oftentimes their concerns extend for a longer period of time because they've not been able to achieve stability. And anytime, and you can talk to any parent or consumer who's in this room and is cruising along and doing well, and all of a sudden you have an acute episode, it does bring up those emotional concerns and those emotional issues again.
yeah, I wasn't meaning that it was going to be smooth running.
Okay.
I think it's...
You made it sound like they were done. They were like, good.
No, but it's a very recognized issue. So I think it's absolutely true, and there's a whole lack of data about what happens when you've been doing it for 40 years, and you're exhausted.
Absolutely.
So there's a lot of other issues that definitely need to be looked at. Marion, do you have some comments to make? Marion has made many contributions in this area, so I think it's valuable to have her.
Well, you did a very nice job, Anne, and I was really appreciative of the data that you shared and the issues you raised. And one of the things I have struggled with, both from my personal experience working in this area and the research I've done and the lack of research in the literature, is how to open the door for communication when somebody is facing an issue that is emotional or psychological with the medical professional or the healthcare team. And in fact, I've swung a little bit from wanting to evaluate and measure quality of life and talk more about patient-reported outcomes that can be used as a tool to introduce this topic in the medical visit. And so the area that intrigues me now, and I think that we need to have some dialogue and discussion, is how do you raise this issue? And how do you recognize when you're feeling socially isolated? Or how do you recognize when there's other things in life beyond the medical condition or even the therapy that are affecting how one lives and how one enjoys life? It's not just about the therapy or the underlying medical illness. There are other events that are stressors in life. And, who's going to listen and who's going to talk about it? And the medical visit has been described many times as like a medical tune-up. And they're very short, and it's hard to have the person who's, when you're in the office, how do you get beyond those medical issues to introduce these topics? So I think, the advocacy programs, the Oley Foundation, other foundations that are providing peer support and other ways for people to communicate are very helpful in raising these issues. So anyway, those are my comments.
Well, and I would like to add too, because I do appreciate you saying that, because sometimes we as an organization really stress how to integrate your therapy into life and put that therapy in the background. But what we forget sometimes is that we never step back to look about what a freaking amazing job everybody here is doing, because you are doing so much. And when I talk, to our pharmacy team and try to explain them, quality of life, and I talk about, this is what people need to do to manage their TPN, and this is what they need. They're doing the same thing that you would do in the hospital, but they're handling it and managing it in their home. They're managing their disease state, they're managing their hydration, they're managing their pumps, they're managing their supplies and deliveries. In addition to that, they're up in the middle of the night, and they're taking care of pumps. And then, they actually have lives too. So they have family members like, someone spoke of it, that has to cook dinner, do dishes, help kids with homework. And then, believe it or not, just because you have a chronic health issue in RN, TPN, and enteral nutrition doesn't mean you don't have other tragedies in your life. You don't, you still lose family members, you still lose jobs, you still have financial woes and other issues that every one of us faces on a daily basis. And so, to be cognizant of that as a medical team and to understand that, I know that, some of these symptoms that people express may not be related specifically to the disease or therapy, but it's the overwhelming nature of that piled on with everything else that happens in life. And sometimes asking the question just needs to happen, and sometimes we forget about that because, I say we, because I'm not providing the clinical services, but I think that sometimes clinical teams are so focused on managing that physical health and nurturing the body that they forget about nurturing the mind. And so one of our I guess concerns, and while it's not, pure science, and I understand that, I think we were just really concerned that we needed to bring up that question and say, what can we do moving forward? And I know Marion and I, we've talked before, not only about the emotional challenges that people face, but what causes people to be better able to cope with the challenges that they face and to get at those skill sets so that we can help better support people so that when they face this crisis or face this new experience, that we have a toolkit, or there's a way that we can help them better adapt to their environment. Do I need to shut up?
A little bit, yeah. You've got some questions here. We should give them a chance. Wait a minute. You would like to speak?
Go ahead.
Okay.
Oh. Hi. Just so that everyone knows, too, there are advocates in waiting and advocates that are close to home you might not even realize through your TPN provider or your durable medical equipment company. They might even have a nutrition support clinician on staff to help you manage this. If you're getting cancer treatment or you're going to an ALS clinic, they might be able to get you in touch with a social worker so that you're not going out there trying to find a therapist and not sure, where to go for that. They might be able to connect you. And a lot of times we see someone leave the hospital and, IR could have placed the feeding tube and a hospitalist could prescribe the tube feeding, and they're going and getting chemo and radiation, and a GI doctor. And who do I go to when I want to know more about my tube feeding or I want to change the formula? And just know that if you go back to your medical equipment company and your home solution provider, that they might already have an advocate there waiting for you that you don't even realize.
The person at the back whose hand is up.
Donna.
I think the key thing is to normalize it. In our society, just like eating shows that you respect your mother because she cooked the dinner, your ability to care for your child or your husband or your partner determines your value personally. So we don't like to admit that we're overwhelmed. We don't like to admit that we have no money. We don't like to admit that we're stressed out and need a break. And I think it would be really helpful if clinicians, when you tell somebody during a crisis, you know, you may have trouble coping, you're thinking, get me beyond this crisis. But as Ann mentioned, having a toolkit, normalizing it, saying, here are the common things that caregivers experience, here are the common things that consumers experience, so you know, hey, dang, I'm not a weirdo, because you don't want to admit those things. Those are very negative things. And then I wanted to also mention, I volunteer for our Title V program in our state. How many people here know what Title V is? Has anyone here heard of Social Security? Mm-hmm. Part of the Social Security Act in 1935 started being concerned about children with special needs, physical, intellectual, or medical disabilities. And we hate that word, but you have to use that word. And every state right now has a Title V program. It's funded by the Social Security Act. And because they figured the health of a child depended on the health of the mother. Now we're trying to extend that to and families. But right now, your Title V programs in every state are putting forth their 5-year plans. And in Kansas, we have 5 priorities for our special health care needs population: family caregiver health, training and education, care coordination, behavioral health, and something else that's very important. And so now is the time to get involved with your director in your public health departments so they see what's going on and you become part of the priorities.
Thank you very much. Now, Heidi, do you have a very, very, very quick question?
Thanks.
That'd be quick.
My daughter, okay, yes. She had feeding trouble. As soon as she had the NJ2 placed and then a G2, the GI doctors pretty much considered her fixed. She's being fed now, so everything's wonderful. And we were sent home not given a plan to continue to try to get her to eat by mouth or anything. But then maybe 10 months later, when she went on to TPN, she was on TPN for a few months, and then all of a sudden, the same GI doctor came in and said, my God, this child is still on TPN. What have you done to try to get her off it? No one tried with the feeding, with the enteral feeding, and no one gave support once she was on parenteral feeding. What am I supposed to do as a parent? There needs to be. I really think that when a child, especially or an infant or toddler, whatever, starts onto enteral or parenteral nutrition, that day one or even before that, it starts. There's education that starts. What is mom supposed to do? What can I do to support this child?
Okay, Heidi, do you want to answer that?
Well, I agree with you, Heidi. I think that education is an important piece, and sometimes that's something that's very lacking, especially when you don't have a comprehensive team that's involved with you. And I know parents that I've talked to, it's certainly a great challenge because we as parents, I mean, I know we've talked a lot, Emma talked a lot about the importance of food, but to nourish your child seems like a fundamental role as a parent. And so parents are so vested in trying to see their children succeed. And sometimes parents feel like failures. They feel like failures when hearing from their team when their child doesn't grow. I mean, I've talked to parents who have cried after visits because they felt that they've done everything that they could do, and yet their child isn't growing or not making progress. And I think sometimes, and this is just a perspective, this is no valid data, but I think sometimes when clinicians get frustrated, parents often feel like it's your fault that you didn't do it.
Do you have a very, very quick question?
I just wanted to comment on being on both sides. I'm a child clinical psychologist, worked with children in a medical setting with short bowel before having my own child, so really seen both sides, and my child also has mental health concerns. And a couple of the things that I've noted is, A, nobody asks. Nobody asks about mental health needs. Nobody asks about the parent. I think there's a reluctance as a parent that you'll lose credibility or you're just being hysterical or anxious if you report to your physician any mental health issues. I also think there's a big overlap between the medical and the mental health, and it's really difficult to tease it out. Even with the background I had, we were seeing what we thought was depression symptoms, anhedonia, lack of interest, feeling down, and it ended up being severe iron deficiency anemia. And so what looked like a mental health problem when we were going the mental health route actually was medical. And I think the other issue is we've seen a psychiatrist for a year, and GI doesn't know psychiatry. Psychiatry doesn't know GI. What do you do when you've got a foot of intestine and you're trying to find a medication as far as absorbency? So I think it's a very, very difficult thing. And I think, Dr. Howard, what you mentioned, that sometimes adding the wrong person can make things worse. And it's really critical that if you're going to add somebody, it's somebody that's really capable and experienced, because I think at times the wrong treatment is actually worse than no treatment. And ideally, finding good treatment is obviously the best.
Well, thanks for that contribution.